Hey guys, today we're going to talk about whiplash because I just saw a patient that's been having chronic neck pain and stiffness from a T-bone accident that occurred about a year ago. So I thought I'd show you guys one of the things that needed to be done for her to get some range of motion back in her neck. Because I've had whiplash, many of you probably had whiplash. What happens with whiplash is you get your head gets flung forward and then backwards. So there can be injury both in the back and in the front. So one of the things that happened with this particular injury is the platysma. This is the platysma. The platysma is a muscle that lives in the skin and it tenses this part of your neck. You can see it, right? All of that is the platysma. It goes from the upper pec, the clavicle, up the front of the neck and attaches around this area in the mouth. Okay? Its job is basically, it's like a tent. It creates an open space around your neck to make sure your carotid artery and all of the delicate nerves, blood, and arteries and veins of your neck are supported. So when you contract, it creates a lifting space for everything that's in here. So with a whiplash, it can get stiff and stuck. So let me teach you guys a little bit of how to do that, how to address that yourself. So I'm gonna go to my office. Naturally, because I spend time with my kids Monday through Wednesday, I'm working all day on Sunday, and today is no different. Okay, so the platysma. Okay, so what you would want to do is one hand here, one hand there. It's a little hard to do on yourself, but it's doable. And you just create a little bit of stretch. So you push down, push up, release one hand, release the other. Push down, push up, and you want to hook everything in here. So you want to pull this skin up. You can't see because I have a beard, but you literally want to do this. So it's a hook, 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 down, down. So push, push, release, release. And you would just do that maybe 50 or 60 times. Up, down, relax, relax. Up, down, relax, relax. And you do it both sides for the platysma. For her, this relieved a lot of neck pain, so she couldn't turn her head very much. Everything was very stiff, and that specific muscle was very tight and stuck in the skin. So that was the treatment we did for it. I did for it today, and it's something you can do it yourself. Do at home yourself. It's all of this skin. So if you grab this skin in here and it's tight and tender, especially when you do this little scrunch maneuver, then this is something you can do. Here, push down, push up, push down, push up. You want to try to get this skin, because this is a skin maneuver. Push down, push up, push down, push up, release one hand, release the other. Push down, push up, release, release. Push down, push up, release, release. And do that 50 or 60 times, and then see how your neck feels. I think you're gonna notice that there's a lot more freeness in the front of your neck. A lot of people don't even notice how much stiffness is present in the front of the neck until it's gone, and then you're like, whoa, it's a big difference. So, just gonna talk about that. It looks like German. I don't understand German. So, I'm at the good old office today. I'm going to, while I look at questions here, I'm just gonna do some laundry. This needs to be started. So I did my duty, so folded the laundry, and now I'm gonna go to somebody's house. I gotta go to the hills. up in those bird streets. Those of you guys know the Hollywood Hills up in the bird streets. It's where most of the Hollywood type live. Okay. Yep, today's a work day. Pretty much every day's a work day. Just in a different way, shape, or form. Where are my keys? No chucks. Where are my keys? I'm gonna wait for some questions related to that while I get my errands done. This is not my laundry. It's my. I rent this room because most of my patients are at people's homes, but I do see some here because it's cheaper for them and I can consolidate my schedule. But it just always depends on what the schedule's like, where they found me, and that kind of thing. Okay. So where are my keys? There. Of course, I lost my keys. Does anybody have any questions related to that whiplash scenario that I just discussed? How did my keys go? Hope my patient didn't take them. That would be no fun. All right. Well, I seem to have misplaced my keys. It's a bit of an issue. So hopefully my patient didn't take them. So I'm gonna have to get off here and call her and see. But that was a whiplash tutorial for the platysma muscle. You guys should give that a shot yourself. And I need to find my keys before a little problem occurs. All right. Happy Sunday. See y'all later.